Namaste. Welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. Before starting today's topic, I want to welcome as many new members have subscribed this channel. So I welcome them all and I request them to go through the very first lecture till today's lecture, as almost 100 plus episodes are uploaded on the YouTube, so they will get the discussions which are already happened in this channel. So again, I welcome you all and let us start with today's topic regarding Amla Pitta. In last lecture, we have discussed about the first set of Hetu like Guru, etc. I will not repeat that. They create Agnimandya as their Agni Viruddha Gun and then Agnimandya Amotpatti, and because of weakness of Agni or Agni Daurbalya, whatever food is taken inside is get fermented and then Avipa, Klama, Udgar, all the symptoms start happening in the body. And when this happens for longer time, it becomes Chirakari, and then we can distinguish that it is Amlapitta, and if it is a short duration, we can diagnose it as Ajirna. We have discussed in that. And at the last, in the last episode, I have asked you one question, that what about the Tishna Ushna Vidahi Hetu, which are also described in the Amlapitta. Let us discuss this topic. It is very important because in my opinion again, this set of patient is more seen than the set of patients which we have discussed in last episode. So it is very important clinically. Now, a patient having Ushna Tishna Vidahi Annapan, spicy food, Jagran, and any even Madhyapan, etc. All these Hetu are naturally Pittavardhak. So in this patient, Daha, sometimes Chardi symptoms are seen of Pitta Prakop. But when you think of Amla Pitta as a disease, what actually will happen to them? As I said, these are all Agni Vardhaka, Ushna Ishna Guna are Agni Saman, so they will inflame Agni, and in my opinion, chances of Agnimandya Amotpatti are very less. In practice also, you will find that they will ask, the patient will say, I have burning, or even I eat some more spicy, I immediately start burning sensation. But rarely he says that I have got Agnimandya and Ajirna and that type of symptoms. The symptoms which are of Pitta Prakop are easily seen than the symptoms of Ajirna. This is my observation in my practice. So, if Ushna Tishna Vidahi Hetu are described in the text, they must have some relevance in this patient, and let us see what we may be happening in the, or what maybe means what happens actually in the body. When patient consumes this Pitta Prakopak Hetu for a longer time, first few months or say days, they don't have any symptom. After consumption as goes on, then burning, sometimes rulas, katudgar, etc. symptoms start happening. When Hetu Sevan prolongs more and more, these Tishna Ushna Hetu or Uksha Hetu Guna are exactly opposite to the Antastvacha, or what we can say the internal mucosa. It is of Snigdha Guna, and that's why when consumption of such Pitta Prakopak Hetu is for a long period, these guna start destroying the internal mucosa. As I said, these are Agni Vardha guna, so Agnimandya and further Ajirna etc. Samprapti is rarely seen. But destroying the mucosa and then burning in spite of food, without food, or even a small amount of spices triggers the burning, and sometimes chardi and saratta chardi is seen. What it indicates? Yes, these patients having pitta prakobak hetu sevan for a longer time, in spite of classic samprapti of amla pitta, they move towards the peptic ulcer, gastric ulcer, or parinam shul we can say, or vanospati, because these hetu, in spite of having action on agni, they destroy the internal mucosa, and hence these are more prone for the ulcers. And you will find that any patient with the ulcer must have gone with the consumption of this pitta prakopak hetu. Then what happens to the agni in that case? See, if it also prolongs, patient neglects these conditions, then the shul increases, burning increases, and as I said, saratta chardi like symptoms or saratta mala pravrutti also is seen. Now, after some time, if it again goes further because of neglection of the patient, then agni is the ashray of the grahani area, but this hetu destroy the ashray itself. So if we consider ashray ashray bhav, grahani is the ashray and agni is the ashray in that organ. If ulcer and further samprapti goes beyond the limit, then ashray nash results into ashray nash. Understand? Grahani organ as such is disturbed, it becomes faulted, and that's why the ashray agni also has the effect in that case. So in amala pitta, when they are described tishna ushna etc hetu, in my opinion they head the patient towards the ulcer conditions than ajirna conditions. So whenever a patient with burning without food or after food, whatever it is, the symptoms, always go for the hetu sevan first and think about the ulcers in first priority. If you have some agitation in the mind, even you can go for the endoscopy also to confirm your diagnosis. Not every time ulcer is seen, but erosion of the mucosa is also seen. Small bleeders or rakta strav is also seen. So anything which is pitta prakopa is seen in such patients. So in my opinion, this set of guna or hetu destroys the internal mucosa, and saratta chardi, burning, daha, or erosion of mucosa like symptoms are commonly seen. I want all of you to share your opinion on this topic, because the samprapti which I have mentioned in this set of group is different from the samprapti given in the text of amla pitta. So please share your opinion. In this condition, as I said, hetu is have more effect. Similarly, pitta prakriti or having tikshna also plays the role in addition to the symptoms. Is always remember. So I want all of you to share your opinion on this logic which I have seen in the practice. In the next lecture, we will come with the another type of Amla Pitta seen in the practice, which is also commonly seen, and we will discuss about that topic in the next lecture. Thank you very much.